Lower dentures can be a little bit of a problem when you only got a thin horseshoe of bone, and the denture will move from side to side, and every time you have sticky food it will move up and down. 2 simple implants at the bottom can make that perfect. We're very lucky to have a clinical dental technician working with us in Elmsley House. And there are 2 ways of doing it. He can make you perfect, brand new dentures to start with, which are made to the best of his ability. Then, as the implant work carries on and the implants are ready to actually build upon, we can use the same denture he's made to actually connect directly in your mouth, straight in the chair, there and then. This is obviously a very, very useful process because it cuts down on appointments and it gives an instant result. There is no downside to that other than having to have the denture made beforehand. The alternative is you have all the surgery, you have all the work done there with your old existing dentures, and then simply at the very last stage you have a new set of dentures, top and bottom made, which will then be made to the implants, and they will then click in and be perfect. This step just requires a few extra appointments.